Lupus is an autoimmune inflammatory disease that occurs when your body's immune system attacks your own tissues and organs. There are many symptoms for lupus. A fever higher than 100 degrees Fahrenheit affects many people with lupus. The fever is often caused by inflammation or infection. Inflammation caused by lupus can affect many different body systems, including your skin, joints, blood cells, brain, and hair. The symptoms of lupus also differ from person to person. Some of the common symptoms of lupus include muscle and joint pain, weight loss, fatigue, light sensitivity, fever, and headaches. Lupus symptoms also usually come and go. People with lupus can have many different skin problems like rashes or sores. You may get rashes on any part of your body that is exposed to the sun, such as your face, arms, and hands. The most distinctive sign of lupus is a butterfly-shaped rash over your cheeks and nose, often followed by an exposure to sunlight. This occurs in many but not in all cases of lupus patients. Many people with lupus have hair loss or thinning hair. If lupus skin problems are causing your hair loss, your doctor can recommend medicines to treat your skin problems and help protect your hair. 1/3 of individuals with lupus also develop Raynaud's disease. Lupus-related Raynaud's usually results from inflammation of nerves or blood vessels and is triggered by stress or by cold temperatures. With Raynaud's disease, the tips of the fingers or toes turn red, white, blue, or purple. This may be accompanied by pain, numbness, or tingling. Many lupus patients also experience pain and stiffness with or without swelling. Joint problems related to lupus usually don't cause long-term damage. Common areas of muscle pain and swelling include the neck, thighs, shoulders, and upper arms. Many vital organs are also affected from lupus. Lupus can trigger inflammation in the lining of the lungs. This causes chest pain when breathing deeply. Many people with lupus also experience brain fog, which results in confusion, memory loss, and trouble expressing thoughts. Lupus increases your risk for heart disease, including coronary artery disease. When blood flow to the heart is completely blocked, it causes a heart attack. These patients are also at high risk for developing a stroke. Lupus patients also struggle with kidney problems called lupus nephritis and tend to have high blood pressure, weight gain, swollen ankles, and decreased kidney function. Lupus can be difficult to diagnose because it has many symptoms that come and go and can mimic symptoms of other disorders or diseases. The cause of SLE are unknown but are believed to be linked with environmental, genetic, and hormonal factors. Anyone can develop lupus. However, women get the disease about 9 times more often than men. Most often, it happens in people between 15 and 45 years, but lupus can occur in childhood or later in life as well. Lupus is more commonly seen in African Americans than in white people and is also more common in people of American Indian and Asian descent. Research shows that certain genes play a role in the development of lupus. If you have a family member with lupus or another autoimmune disease, you may be more likely to develop lupus. Living with lupus can be physically and emotionally hard. While there is no cure for lupus, current treatments focus on improving the quality of life through controlling symptoms and minimizing flare-ups. This begins with lifestyle modifications. Choosing to eat a healthy, well-balanced diet rich in fruits, vegetables, and whole grains can help prevent or manage other health conditions you may have, like high blood pressure or diabetes. There is no special lupus diet you need to follow. Just work on building a balanced diet with healthy foods you enjoy. Staying active is the key to improving outcomes. The muscles are the most common target of lupus inflammation, and many people are unable to complete basic exercises. This lack of activity, though, can lead to eventual disability. Exercise to help keep your body strong. However, talk to your doctor before starting an exercise program. Increased sensitivity to sunlight is common among people with lupus. Sun exposure can cause rashes or trigger flare-ups of the disease that could affect internal organs. So it's important to protect yourself. Wear protective clothing such as a hat or a long-sleeved shirt and use sunscreen anytime you go outside. Help can come in many different shapes and forms, so keep the line of communication open. Reach out to online and community support groups. Talk to your family and friends about your lupus to help them understand the disease. Always ask for help when you need it. Most people with lupus take several different medicines to manage their symptoms, from anti-inflammatories to steroids. Remember that any medicine you can take for lupus can have side effects. Talk with your doctor about the changes you notice after taking your medicine, and tell your treatment team right away if you have any side effects. The prognosis of lupus is better today than ever before. With close follow-ups and treatment, 80 to 90% of people with lupus can expect to live a normal lifespan. Everyone can help solve the cruel mystery of lupus. For more information, please log on to www.lupus.org. Thank you for watching, and I'll see you with another video.